Hi, I'm Jen Mattoni with the Suicide Prevention and Postvention Committee. And today's webinar is about preventing educator burnout. And we're going to have two guests joining us from Mzima Consulting. Dr. Natalya Bogopolskaya is a nationally certified school psychologist and consultant for Mzima Consulting. Her expertise includes promoting protective factors and strengths for students. Her dissertation at Philadelphia College of Osteopathic Medicine examined the relationship between resilience traits, post-traumatic stress disorder, and post-traumatic growth in suicide loss survivors. She's also a board member for the American Foundation for Suicide Prevention. Dr. Kendrea Hart is the founder and CEO of Mzima Consulting. She's known as an ardent advocate for youth with disabilities, mental health conditions, and environmental psychosocial stressors. As a school psychologist for 2 decades, she's worked in education, public health at the CDC, juvenile justice, and nonprofit and community-based agencies. Workplace suicide prevention and the national guidelines are part of a collaborative partnership between the American Foundation for Suicide Prevention and United Suicide Survivors International. Here you can see the 8 guiding principles that make up a portion of the national guidelines. The goals are to engage employer and professional association leadership to address suicide prevention and mental health promotion in a comprehensive, sustainable, and impactful way, and also to provide a roadmap for them to use as they undergo this culture change process. And here we have the 9 practices that are part of the national guidelines. They're organized into upstream or preventative practices, midstream or early intervention practices, and downstream, which are crisis response practices. And I'll now turn it over to our guests.
Thank you so much for having us. So today we'll review the data of educator burnout and suicide rates in education in the United States. We'll also review risk factors and protective factors in the field of kindergarten through 12th grade education, and we'll address educator burnout as well as some action steps. So what is the concern in K-12 education in the United States? According to a June 2022 Gallup poll, K-12 teachers report the highest burnout rate of all U.S. professions. More than 4 out of every 10 teachers note that they feel burned out always or very often at work. And this is due to a number of reasons that we'll address in the risk factors section. According to a U.S. public sector workers survey, K-12 public school educators were the most likely profession to report higher levels of anxiety, stress, and burnout, and 55% reported being ready to leave the profession early. This is frequently covered in the media, especially since COVID-19. So these concerns have been exacerbated by the impact of COVID-19, especially since returning to schools after virtual learning. And this is a concern not just for teacher burnout, but it's also a student mental health crisis, which is impacting all of the education community. So what are some mental health risk factors in education? We can start with the work expectations and workload that teachers are facing, their burnout, which dates back to 1983 in some articles and reviews of what is happening in public education. A lot of compassion fatigue that teachers are connecting with their students and hearing and experiencing their trauma with their students as well as their colleagues. And this is also a secondary trauma exposure. We can also address any sort of hostility or aggression toward the school staff, whether it be within the school community, the district, or the state, or the media, any sort of discomfort that teachers are experiencing, and controversy with families instead of having a collaborative sense of environment or having some confrontation. There's also been a reduction in teacher autonomy in terms of what teachers can teach or plan, or wanting to do an intervention for a student, but perhaps needing to collect certain data before they can do that intervention. That is a very commonly cited source of burnout and stress in the literature. We have to consider the different stressors that different districts or schools have within the community, right? Teachers are people just like everyone else. And so you have different stressors that are happening at home, which are the personal stressors, but then what is happening in the school setting? Who's the administrator? Are teachers experienced or new? What kinds of supports do they have when they are new teachers? There's also a lack of emphasis and training regarding educator mental health and suicide prevention. So in schools, there are many trainings, and rightly so, addressing mental health of students and how to identify suicide risk factors in students. However, it's very rare that there's training on how to identify suicide risk factors in our colleagues or mental health risk factors in general. So with this, there is good news in the data. Although our most recent data, especially post-COVID-19, is showing that burnout is being reported highest in the field of education, data from 2012 to 2016 from the CDC shows that actually education ranked lowest for both men and women. And we're curious to see if this will continue to stay the trend, even once we have new data, given the impacts that we've seen in the past 3 years. We believe that some of the reasons that the field of education is ranking lowest for suicide rates is because of these protective factors that we experience in the field of education. So we have the school community. So even though I address some forms of criticism and stress and lack of autonomy, you also have a sense of camaraderie. So teachers and different staff members in the schools have a relationship with their colleagues, the students, the families. There are also breaks and holidays integrated throughout the school year. So although we know that some staff members take work home, for the most part, those breaks are there and people don't have to stress about taking personal time off to have that break or space from the work building and so forth. There's also a limited physical health risk compared to other fields. Of course, we know that in some schools there are physical health risks, but for the most part, compared to other professions, this is a protective factor. Additionally, there's a lower rate of competition. So while, for example, in the school where I work, there's constantly competition about which class has the best attendance, or in some value-based assessments in some districts where teachers' salary may depend on their classes' test scores, for the most part, there's no competition between teachers in the same way that we may see in sales, for example. In schools, we also have limited access to lethal means. We also have health benefits. So thinking about health insurance, calling EAP, any sort of access to mental health supports, including mental health trainings, especially since COVID, we've seen many districts address practices such as mindfulness and how we can support our teachers in implementing those practices in their personal lives, as well as for their students. And finally, there's a sense of stability. We have a teacher shortage in this country, which is a risk factor and increases the stressors that teachers experience. But on the other hand, there are very rarely layoffs in the field of education. And this is a protective factor because there's always a position for teachers if they are ready or willing. So next, we will transition to action steps and resources.
Thank you, Natalya. So we know how important teachers are to our society as a whole, and especially to our students. And so we want to talk about ways to address educator burnout based on what we've seen in the literature and also anecdotally what we've seen as educators. So what are some schools doing? So peer support in that context of community is really important. So some schools have built-in peer support opportunities and sometimes mentoring opportunities for educators in the school setting so that they don't feel alone. Also, you're seeing more and more schools who are emphasizing things like wellness initiatives, yoga, a stress day, and just socials, making sure that there's some fun opportunities for colleagues to connect. Check in with mental health professionals. We're beginning to see more administrators actually encourage educators to do those check-ins. Teacher recognition, one of the major factors for educator burnout is oftentimes feeling underappreciated. So making sure that teachers are being recognized for their efforts. Targeted professional development. So as Natalya mentioned, we have a lot of professional development that addresses mental health of students oftentimes and suicide prevention for students, but we are beginning to see more professional development address areas such as self-care and wellness for professionals. Initiatives to improve school climate. So we talked about community being a protective factor, but we do know that school climate can vary from one setting to the next. So if the school climate is showing as an area of need, there are targeted ways to make sure that we improve school climates, and schools are taking a look at that. And you can always look at teacher attrition as a sign that maybe there's something that needs to be addressed in the school climate. And then employee assistance programs. Most school districts have employee assistance programs. Some may have more resources than others, but encouraging educators to take advantage of those programs, especially counseling support. The National Education Association has some guidelines to address teacher and educator burnout. So basically, some of those things are, like we mentioned, trauma training to help identify trauma in students, crisis teams in every school building so that educators and teachers who are not trained to be mental health professionals feel like they have support when students need that social emotional assistance. Mental health professionals to help with those duties of supporting students and making sure that they're not having to be in administrative roles, which takes away from their ability to support students. So as mental health professionals can actually help students, that alleviate some of the stress for teachers. Partnering with local mental health professionals to provide a range of services for students and employees, tracking the long-term effects of the pandemic, and then increasing staffing, such as counselors and nurses. So we know that there are teacher shortages. There are also shortages for support staff, and then really prioritizing stress counseling. We believe in a holistic approach in terms of how to support educators, connection and community, recognizing what is already happening to support staff and students, and then addressing martyrdom in education. So oftentimes we really want to encourage educators not to feel like they need to be martyrs and to make time for themselves to actually do enjoyable activities. We also agree with the NEA that crisis supports are very important for students and for adults in the building. Understanding self-care versus self-compassion. So sometimes if we're not able to do what we think of as typical self-care, and it can look differently for different people, having self-compassion so that you're not setting expectations for yourself that add to the everyday stressors. Taking care of school employees the way we take care of students and expect them to take care of our students. We want to make sure that they're feeling supported, and also training staff, as Natalya alluded to be able to recognize warning signs within their colleagues so that we can make sure we're giving them supports if we're seeing that stress is being really exacerbated or there's signs for mental health concerns. Natalya and I are with Mzima Consulting, and we recently had an educator retreat with the intention of really being there to support educators, to love on them, to give them wellness activities, and actually help them to regenerate and rejuvenate from the year. So it's very important to us that we show them that they are cared about, and also to give them strategies to support themselves throughout the year and also support their students. Thank you.
Sometimes self-care cannot be a break from hard work, but it may be self-compassion for hard work without a break. And this is something that I tell the families of the students that I work with, as well as my colleagues in the school setting. And here are some additional resources that we hope you can turn to if you would like more information.
Thank you so much to our presenters today for this really important information. And we now like to ask all of you to take the pledge to make suicide prevention a health and safety priority at your workplace or professional association. And you can do this at workplacesuicideprevention.com. And that's where you'll get all kinds of information, and you can become one of our pledge partners. Thank you so much for joining us.